Okay, so this is going to be the first case that we're going to look at some of the psychiatry medications. Excuse me. So here's the loading objectives. And we're going to be looking at a couple of different classes. And so if you're following along in a textbook, we're going to be skipping around quite a bit. So we're going to focus these lectures on drugs that are specific to the conditions or the diseases that are associated with the case. Okay, so if you're looking ahead, obviously we're going to be looking at bipolar as one of the first cases. And bipolar is characterized by essentially two moods. And I like this diagram because, or this picture, because it essentially captures what we're talking about. We're dealing with sadness or classical depression, followed by periods of mania, which looks kind of like this. And so there's peaks and troughs um, between, mood, and basically these people have two different mood experiences. Um, Other terms in terms of bipolar include manic depressive disorder. So it's depression followed by mania, followed by depression, followed by mania. Um, and Dr. Dance goes into a lot of the clinical features and hallmarks of this disease, and so I'm not going to spend any time on that. I will draw your attention to bipolar disorder and how it's depicted in terms of culture. We can look at Dr. Jekyll and Mr. Hyde from the 1880s. This is stereotypical and somewhat inaccurate in terms of the cultural references of patients with bipolar disorder. More currently, we can talk about movies such as The Silver Linings Playbook with Bradley Cooper and Jennifer Lawrence, and my favorite actor Robert De Niro, as well as Homeland, which is a series that I didn't watch because I don't have time, but I've heard there's a component to the main character that has bipolar disorder. And of course, for the art buffs, we've got Vincent van Gogh, who was suspected of having bipolar disorder. And so the first group of drugs that we're going to talk about are the SSRIs, which we actually had mentioned in a previous case several months ago. So SSRIs stand for selective serotonin reuptake inhibitors, and the prototype here is fluoxetine, of course, which is the brand name Prozac that was released in the clinic in 1987. And then other SSRIs are listed here. Essentially, they're equally efficacious. The only thing that's really different between them is the cost of these drugs, as well as the clinical data and clinical experiences with all these drugs in different diseases and so forth. Fluvoxamine is unique in that it's not officially approved for depression here in the United States, but it is approved for OCD, and we'll talk about that later. One of the things that you can, a mnemonic device that you can remember these drugs is that they are effective for sadness, panic, and compulsions. And the acronym EFSPC stands for the drugs escitalopram, fluvoxamine, sertraline, paroxetine, and citalopram. And so that's a nice memory device you can use. We had talked about the mechanism of action of these drugs in an earlier case, and basically they inhibit the reuptake of serotonin, and this is a receptor that's found on the presynaptic membrane of the neuron, and essentially what happens is that when this receptor is inhibited, we've essentially increased the half-life of serotonin within the synapse. And so basically these patients, which are suspected to be deficient in serotonin, when they're put on this drug, now they experience a normalization of serotonin levels because we're basically reducing the recycling of this neurotransmitter. And so there are other mechanisms that exist in order to increase the amount or increase the activity of serotonin. SSRIs are just one of those examples. And we'll talk about some of these other mechanistic features as we kind of go through the curriculum. I just want to remind you that other pathways exist for drug targeting. SSRIs are really kind of the frontline therapy for depression, but we can also use them quite well in panic disorder, OCD, anxiety disorder, PTSD, PMS, bulimia, and other somatoform disorders, which Dr. Dance will talk about. These drugs are pretty well tolerated. Minor side effects include diarrhea, dizziness, dry mouth, and headache. Um, Major side effects include insomnia, weight gain, agitation, panic, I know, it's ironic, and drowsiness and suicide ideation. And so this is really important because patients that have a high risk of committing suicide need to be watched on this drug very, very closely. Um, and Dr. Dance will talk about that in an upcoming lecture. I don't know if he talks about it early on in the curriculum. The adverse effects are best summarized by the memory of the three S's. Basically, most patients experience this. They experience stomach upset, some type of sexual dysfunction, as well as the possibility of a serotonin syndrome, which I know we've talked about, but we're going to remind you about this syndrome in a couple of slides. In a previous slide, I had showed you the chemical structures. Of course, you're not responsible for any of those, but the structures of these SSRIs varies widely. And this is kind of how you see a lot of these CNS drugs looking. Uh, Even though they are specific to serotonin, we can also see other receptor effects. So many of these drugs have alpha, particularly alpha-1 antagonism effects, histamine effects, as well as nicotinic or muscarinic or both. Paroxetine, for example, has some acetylcholine antagonizing activity. But as a group, they offer good oral administration. They offer really good brain penetrance. So they get across the blood-brain barrier because most of their chemistry is lipophilic in nature. They do have long half-lives, and that lends itself to once daily dosing, which is really important for these patients as well. And there is a hepatic biotransformation component that we need to discuss, and we'll do so at the end of this lecture. There is a prevention of a negative feedback mechanism that operates at the serotonin autoreceptor level as well. There are numerous drug-drug interactions. We already kind of mentioned serotonin syndrome. This would be evidenced when you see an SSRI combined with another centrally acting drug called monoamine oxidase inhibitors, as well as a few others. Tamoxifen, which is a SERM, selective estrogen receptor modulator, specifically identified for estrogen receptor positive breast cancers, also has a drug-drug interaction with these SSRIs, the mechanism of which is slightly unclear. Other drug interactions that we need to be aware of include these enzyme interactions in terms of these drugs with different enzymes. And so you don't need to memorize this for the exam, but you will need to at least know the basis for this. And I'll show you how to predict some of this material in an upcoming couple of slides. This is important because a lot of these patients are going to be on several drugs. As you kind of go through the CNS component, you're going to see that several of these drugs may be put on board, and a lot of this is going to be a drug-drug interaction. Okay, some classic agents like antifungal agents and antibiotics and antivirals would be put on board as the patients pick up these diseases, of course, and then that lends itself to an acute drug-drug interaction that may hospitalize the patient at the most extreme end, or may cause an exacerbation of side effects at the most basic end. So interesting notes on the individual SSRI. Citalopram is associated with a dose-dependent QT interval prolongation. There's also a well-documented CYP2C19 variant, and that really plays a role in patients that are on warfarin as well. Escitalopram is an isomer of citalopram, and so you see some of those QT elongation effects, but it lacks the enzyme inhibition pathways. Fluoxetine, we talked about those drug-drug interactions, in terms of the CYP enzymes. Fluoxetine offers the least amount of weight gain, so that's one of the pluses for this drug, which is why Prozac, which is the generic or the brand name of this drug, has become so popular over the years. Conversely, paroxetine is associated with the most weight gain. Other drugs in this class have different formulations as well. You can see them in controlled release, which offers less nausea. You can see them put into a liquid formulation. And all this basically plays a role in assisting different patient subgroups to offer control for anxiety, depression, and so forth. based on their clinical story. And so this is it for SSRIs. We'll continue with other drugs in this category in the next upcoming videos.